Hi, I'm Nina, one of the CAN certified nurse injectors, and today I'm going to be talking with you about current non-surgical treatments for 2024. And I'm going to specifically be talking to you about rejuvenation of the hands, neck, and chest. I've been injecting about 20 years now, and it never occurred to me, first of all, what would be able to do to women's and men's faces, much less would be addressing body parts. So it's an exciting time that we're really able to give clients great care and address some of these concerns. So when we talk about injectables for these areas, when I treat the hands, I like to use Radius. And Radius is calcium hydroxyapatite. They're little calcium spheres. As we age, we start to lose collagen and elastin. And so this product doesn't just give volume back like some of the hyaluronic acid products we inject. It actually is a biostimulatory, and the process is called neocollagenesis. It helps you to make your own collagen. So it's a rejuvenation therapy as well. So when I inject hands, the main reason that I'm doing it is to give back that volume. As we age, our hands start to thin out. We're able to see our tendons and veins. I had my hands done about a week ago. My final result will be in about another 6 to 8 weeks. And if I need another treatment, then I'll certainly have that done. The neck is another area that we inject, and primarily with that, I'm treating necklace bands and laxity. When we treat the chest, the main thing that I'm going for is the laxity as it starts to kind of everything go downhill, and the crepiness of the skin. I picked different concentrations of the Radius based on the thinner thickness of the skin. When I'm doing hands, I want more volume replacement as well as stimulating collagen. So I mix that 1-to-1 with some saline. The product, when I inject it full strength, like I often do on the face, is a 1.5 ml. So when I kind of take and dilute it down and make a slurry so that I'm coating the skin. I typically, when I'm doing the neck, that is really thin skin, so I'll bring that to a final concentration of 1-to-3 ratio. And when I'm doing the chest, I like to inject that at a 1-to-2 ratio. I do that as well when I'm doing above the knees and the arms, because we want some volume as well as some collagen stimulation. Typically, I stage the treatments at about 6 to 8 weeks apart. Most people need 2 treatments. If you're a young person that's really just trying to stimulate your collagen and get ahead of the game, we call it prejuvenation. You may only need 1 treatment. For those of us in our 60s and older, you're probably looking at 2 treatments. We always take baseline photos so we know where we started, and we take final photos when you come back in about 8 weeks after your last treatment. Those are really helpful because you may be coming in a year later, a year and a half. Hey, Nina, do I need another treatment? It's good to go back and look at those photos. Typically then, 1 treatment is enough to really help to maintain those results. People often ask, well, how do you get it in there? Because on the face, we use both needles and cannulas. On body parts, we use almost exclusively a cannula, and there's a lot of mystery about what that is. So I thought I'd show you today. It's not real scary, but basically it looks like a needle, but it's not sharp. It doesn't hurt when you do it. It's a blunt end, and there's a little port where the fluid comes out. So typically, like on the neck, I can do 1 little poke, and that creates a little path for me, and then I can almost like windshield wipe and get a big surface area done. It's much more comfortable, and it's safer, less risk of bruising with the cannula. So this is what we use when we're treating these body parts. And that's something that we've been doing a lot more lately. Some clients are thrilled with their results and they don't need to do anything else but injectables. Other clients like to either in conjunction with or as a separate treatment have some of our energy-based devices. And with that, we use both therapy. We've been using that now probably about 10 years in our practice, so we have a lot of experience with it. Where I think the best results come from that are people with a doughy jawline and some mental under that chin fullness. As we age, we know that it's not just downward, but it's downward with an internal rotation. So we're trying to keep things lifted and lateral. I think that L-therapy is great for those people. I think if you have more skin laxity, more of the necklace lines, that thin skin on the lower neck, and trying to lift the brow, I've found that soft wave is a better treatment for you. And sometimes I'll combine them. I may treat a patient with L-therapy for this portion of their face, and then for the neck and the brow, I'll finish it off with soft wave. So we know that we can really customize to give you your best result. If you have any questions, then please email them to injectablequestions@cynthiagregmd.com. We'll be happy to respond back to you. If you'd like to schedule a consult with any of our nurse injectors, then certainly feel free to do that, and we can see if you're a good candidate for it. And if you would stay tuned, my good friend and colleague, Jennifer, our lead medical esthetician, is now going to be chatting with you about current skincare trends in 2024 that really does go hand in hand with the things that we nurse injectors do. Thanks so much for joining me.